Thank you, Session Chair, and thank you, colleagues, for the opportunity. First and foremost, I want to say I'm greatly delighted and honored to join you today for this important session on demographic dividend and sustainable development. First and foremost, I would like to extend my profound appreciation to the government of Republic of Bangladesh for their gracious hosting of this significant event. I'd also like to express our sincere gratitude to the PPD Secretariat for the commendable efforts in organizing this conference. Excellencies, the 2030 Agenda for Sustainable Development recognizes the importance of demographic dividend agenda in helping countries achieve SDG by 2030. Countries with the opportunities the demographic dividend presents developing countries with the opportunity to accelerate economic growth and achieve sustainable development and social change. The potential result from the changes in the population age structure that occur from declines in both child mortality and fertility during the third stage of the demographic transition period. The majority of Sub-Saharan Africa countries are in the first, second, and third stage of their demographic transition, positioning them as pre- and early dividend countries. This stage offers a critical window of opportunity to implement strategies, policies that can transform demographic potential into substantial economic and social gains. Kenya is on the path to a population structure that may enable it to express a demographic dividend. The DD concept was domesticated in Kenya. Just want to share with you some slides. That was a presentation I wanted to show you. But this is Kenya pyramid in terms of population. It's not projecting, but that is the Kenya overview. I want to share with you. The world today is in crossroad, as we say, or it's at a crossroad. We have countries with aging population and declining population, and with countries with rapid population growth with a youthful population. Africa, and in particular Sub-Saharan Africa, Kenya among them falls in those countries where we have rapid population growth with a very youthful population. Our population size, today Kenya is around 54 million. Out of that, 75% of our population is below the age of 35 years. As you have recently seen in the media, Kenya is experiencing what we are talking about, this demographic shift. In many countries, I'm sure you'll also come to that stage. So if you can see those figures, our aging population is just 6%. When we got independence in 1963, our population was around 10 million. Those above 65 years were only 200,000. Today, they're around 6 million. We expect in the next 10 years, around that number will be will double. So this is what is happening, that demographic development is a temporary opportunity to achieve sustainable, fast economic development. These opportunities result from huge population of young persons, decline in fertility levels, strategic investment in health, education, economic, and governance sector. To achieve DD, dependency ratio must decline over time, but the number of workers must also increase. And that's just a pyramid of Kenya. Obviously, if we compare this pyramid with some of our PPD partners, especially, let's say, China, probably Thailand, this will be a totally different pyramid, even Indonesia. Kenya started this concept of the DD in 2014. We developed what we call Kenya developed the demographic dividend model for Kenya in 2014. The result from the modeling exercise showed that Kenya has the potential to harness the demographic window. But strategic deliberate investment must be made in health, education, economic, and governance. I know there are several ministers from Africa here. And many times we say we want to be like Asian tigers. We want to be like Malaysia. We want to be like Singapore. We want to be like South Korea. What those countries did is that they did an investment, what they call accelerated economic development in a short period. But what they did was to harness their demographic dividend. There are many countries today as we speak who did not harness their demographic dividend. What's happening right now? Their age elderly and poor. What we are advising our countries, especially Sub-Saharan Africa, is that this is the opportunity to do heavy lifting. Heavy lifting, that means in every nation you see that has developed, there's a stage where they sacrifice. So countries like Uganda, Kenya, Tanzania, Malawi, many of them were in that stage. This is the time to sacrifice. In Kenya, we call them the Gen Zs, those who were born from 1996 and above. Those Gen Zs, we are telling them this is the time to do heavy lifting. So even for other African continent, I think this is the time to harness this demographic. Because if we don't harness now, in the next 30 years, because our window of opportunity for Kenya is opening 2036, and many African countries, I know the window is opening now, or probably in that period. If we don't use and harness that period, then we will be a country that is aged, but poor. So this is what we have achieved in Kenya. We developed, at the beginning, we did a survey on adolescents and youth, their numbers, their key concerns, and then we developed the key demographic roadmap. This roadmap, every year we prepare a report, and in this report, it is various sectors. So it's on governance, it's on health, it's on employment, it's on skills. So we report on those key indicators, and it's done by the various ministries. I know because of time, but this is, again, our DD is in line with what we call the MTP, the midterm plan of our country, which is after every 5 years. And Kenya has a vision, the Vision 2030, which we are right now, we want to revise it to in line with the Africa we want by 2063. Also, this DD roadmap is in line with the ICPD 25 Kenya country commitments. In the ICPD Nairobi Summit, Kenya made 17 commitments. So also we aligned our DD with the revised one with the Nairobi Summit. Also, the result of the 2019 Kenya population census is also has captured some of the DD elements. So mainstreaming DD into development planning, DD guidelines developed to guide the national and the county government in coming up with a county-specific DD. So also we have, Kenya, we have a national government, and then we have 47 counties. So we developed the national DD roadmap, and then we developed the 47 county DDs. The county government and the respective ministries responsible for health, education, economic, and the governance are required to utilize the national demographic dividend roadmap to identify activities that are relevant to the individual counties for incorporation into the county integrated development plan. So each county in our country has what we call CIDPs, county integrated development plans. So the demographic dividend is integrated in those county plans. The National Council, which I am the Director General, is the steering, coordinates the steering of this integration of DDs into the planning. So if I give you some profiles, and I've mentioned some of them, this is Kenya. In Kenya, youth is defined those who are aged below that 5 years. I know there are different definitions, but this is, that's how we define them. You can look that by 2035, we expect the current and the projected youth population in millions. So 2009, it was around 11 million. 2019, they're 13 million. As we speak right now, even they're 13 million. 2025, I think, sorry, the in-between. 2025, 16 million. By 2030, Kenya will have around 18 million, and 2035, around 19 million. So what are the interventions that we have done so far as a country? Our constitutions give a lot of reference to our youth population. That's the Kenya Constitution, Article 55. So there are a lot of what we call mainstreaming issues of youth agenda in many sectors, especially in terms of elections or in terms of nominations into political offices. So our Constitution has considered that, especially even for not only youth, but also for women. Also, our Vision 2030 also has mainstreamed issues of youth. The Universal Health Coverage also considers issues of youth in terms of healthcare services, Primary Healthcare Act. The National Youth Council, Kenya has a council that only deals with youth affairs. We also have a national youth policy and many others. Those are some of the key legal and policy frameworks that Kenya has established. But still with this, there are still challenges. So in terms of health, Kenya has rolled out the universal health coverage, development of guidelines on integration of ASRH in primary, secondary, and tertiary levels, promote sustainable resource allocation for family planning, setting aside annual budget line. What we are doing here, we have advocated for domestic financing for family planning. We have said in our country, no one should decide for us on what we do in our bedrooms. In that case, Kenya must prioritize family planning, and the money should come from our GOK, our Government of Kenya money. And we have allocated, currently more than half of the budget comes from our government. I think the other half comes from USAID, UNFPA, Dividend, and others. Devolution of health functions and investment in human and medical resources is another, again, area of interventions, and many others. I don't want to go into that into details. This presentation will be shared. In education, we did enrollment of CBC. This is, we have changed our primary schools system. It is more of now, it's more of hands-on, it's more of a training on key skills rather than teaching them on theory and those things. So the CBC, that is a system that we have just started in 2017. So it's a more of practical system so that people have skills. So, and you can choose your career even from that early age. By the time you are the standard 4 or 3, you can choose whom you want to be. Free primary and day secondary schools. This is one of the initiatives that the government of Kenya did, that our primary schools are free. Secondary schools are almost also free. Introduction and expansion of school meals. Also, we have school meals program to retain learners in school, especially hard-to-reach areas. Provision of sanitary towels to school girls. In fact, there was a demonstration in Kenya recently, and one of the reasons why people demonstrated apart in that bill is because the government wanted to tax sanitary towels, and people went to the street and even went to the parliament to make sure that bill does not pass. And that bill was withdrawn by a president who said, if that's your wish, that's also my wish. Promotion of TVET by encouraging youth to display their skills and talents, expansion of existing TVET institutions across the country. And then in terms of employment entrepreneurship, credit support programs, the Youth Enterprise Development Fund, the specific funds for the youth. And then there's also Women Enterprise Funds and Ways of Fund. These are funds that youth can borrow and do business and investment. Placement of youth in employment locally and abroad through the National Employment Authority. So also in terms of employment, Kenya also works with other countries to get employment for the youth of our nation. Youth internship is, again, there is a program of the government that pays for youth and sends them to all the state agencies, ministries, where they go for 1 year internship, and then they're paid stipend for that 1 year. And the institutions that they are posted is encouraged to absorb them if they have opening in those areas. Putting in place initiatives that promote access to government procurement. Every year, at least we report how much of our procurement goes to the youth, women, and people with disability. Implementation of Talenta Hela. This is a special program where people is like you present your talent, and it is a program that is done by the Minister of Sport. Let me rush. Then in terms of governance, ratification, domestication, and implementation of the African Youth Charter, establishment of independent, establishment of Kenya Parliamentary Association promotes pro-youth legislation, establishment of youth empowerment centers, some of the interventions that we have done. Key achievements is reduction in teen pregnancy from 21% to 15%, reduction in female genital mutilation, I'm talking about the youth. Maternal mortality ratio has also dropped in our country. Use of modern contraceptives increased from 27% to around 57%. Net enrollment at secondary school education increased. Youth informal employment increased from 22% to 30%. Over 15,000 youth have benefited from the government internship since 2019, and this is increasing. Election of youth in various positions during the 2022 elections. We have one governor who is below the age of, he's a youth, 12 women MPs, 5 women representatives, 37 MCS, those are the ones who represent that. They represent wards. And also we have 7 women governors. So in conclusion, the participation and the engagement of youth is critical for achieving sustainable and inclusive development. Youth integration can promote integration integration equity, enhance program outcomes, and help build the skills and capacity of young people. It can also help address some of the challenges faced by young people, such as unemployment, marginalization, and social exclusion. Youth-led and youth-centered approaches have been found to be effective in a range of development, such as health, education, and economic empowerment. Thank you very much, and sorry if I've taken more time than
Thank you so much. A round of applause for him.